Hi, welcome to our series of conversations, which are to impart little nuggets of information, conversations with professionals that work within the field of pain and fatigue, covering aspects like sleep and breathing disorders, and sharing a bit of knowledge, but also conversations with past clients of ours who have done well and shared what they've learnt and how they've improved over time. So we hope you can take something away. As I say, just little nuggets of information that we want to share with you. And so enjoy. Welcome, Emily. Thank you so much. I'm here with Emily, who is one of our specialist physiotherapists at Vitality 360. And she's going to share some of her insights around breathing and breathing patterns. So, welcome, Emily. Thank you so much for taking this time to talk to me and us, hopefully. Hopefully, some other people might listen to this at some stage. But but I mean, we talk about abnormal breathing patterns, and I guess that might be a new concept for a lot of our clients because after all, we're all pretty good at breathing. We've managed to survive so far by breathing,
That's-
but I'm curious. How did your interest in breathing start? What brought you here?
yeah, I think it probably goes back to when I was a teenager. I had asthma, and I it really affected me, my ability to play sports, and I gave up running as a result of having asthma. And and then it kind of I noticed that it really started improving around the time I was at university studying physiotherapy. And I was playing football at that time, and I think there were two things looking back which were quite interesting. So at physio school, we learnt about diaphragmatic breathing, which I'm sure you're aware of. So the classic belly breathing.
Yes.
And I remember when I first learnt how to do that, it really took a lot of concentration to figure out how to breathe from my tummy. It wasn't something that came naturally, but once I was aware of that, it started to just become a lot more normal for me to breathe from my tummy.
Yeah.
And the second thing was the position that I played when I was playing football was central defence, and I was often given the job if there was a tricky striker on the other team. I had to follow them around everywhere and stay very close to them.
Yeah.
And because I was very competitive, I didn't want them to hear my breathing. So I would try and stay as quiet as possible. So I would be really, really close to them, and I wanted to be absolutely quiet. So they were all panting away, and I was very quiet. And so I learned how to breathe extremely quietly, purely because I was so competitive. to,
Oh, practical.
yes, and what I was doing was effectively pursed lip breathing, which is it's a breathing technique for controlling breathing when you're breathless. I didn't know that that's what I was doing at the time, but when I look back, that's exactly what I was doing. And so that's when you're aiming to breathe quietly when breathing is a bit out of control, and you're doing a slow exhale, so like this, and
Okay.
then a inhale through, if possible, through the nose. It's not always possible when you're out of breath, but it does really help to get things under control. So that, and then breathing in through the nose. So I really recommend that as a technique for anybody who's feeling breathless.
So it's called
Pursed lip breathing. Yeah,
pursed-lipped breathing.
yeah,
Okay.
yeah.
Okay. So
So
breathing in through your nose,
yes, if you can,
if you can.
it may take a bit of time to get to the point of being able to breathe through your nose. The first starting point is that long exhale, and then breathing in through the nose. And so it was around that time that I just wasn't using my inhalers anymore. And so when I look back at that, I think had I known about how to breathe effectively, the asthma would have had much less of an effect on me.
Mm.
And I think you see that with there are. I'm just to clarify for the audience. I'm not a respiratory physiotherapist. That's not my specialty. But this has been something that I've developed an interest in our particular client group. So, but respiratory physios, they will see people with respiratory conditions like asthma, like chronic obstructive pulmonary disease, chest infections, and there's a pathology which is affecting those people's ability to breathe. But I think often overlying that is a breathing, potentially a breathing pattern disorder, which perpetuates and makes the problem worse. And in my case, that was, I'm pretty sure that that's what was occurring. And once I was using my diaphragm effectively and learning how to control my breathing when I was breathless, it was not really a problem anymore after that. So
Oh, brilliant. Yeah. So two strategies there, and we might have a little, if we've got time, have a little go at one or two of those later
yeah,
on.
so yeah, absolutely. Oh, there's a sort of second thing to come onto as well regarding my interest in this in our particular client group. So I used to work with an excellent physiotherapist called Jenny McClure. I don't know if you are familiar with her.
Yeah.
Yeah, and she is very interested in hyperventilation syndrome. And we were working in a clinic seeing people with ME/CFS, and we were collecting questionnaires for all the clients that were coming through for a certain period of time who had diagnosis of ME/CFS, and we were giving them what's called the Nijmegen questionnaire for hyperventilation syndrome. And in a normal population, you'd expect to get about I think 5 to 10% of the healthy normal population would have a positive score on this questionnaire. And in this client group of people with ME/CFS, I believe it was about 55% had a positive score, so much higher. And I think this may be similar with other kinds of conditions as well, where you have potentially more. It's not necessarily the definitive diagnosis of hyperventilation syndrome using this questionnaire, but it's an indication that there's something a bit different about that client group, and potentially other client groups that we work with as well. I guess in the clients that we're working with, I'm often observing people who are not necessarily effectively breathing from their diaphragm, or they're over breathing. It's
Mm.
very common observing over breathing.
Mm.
So improving breathing control and the breathing pattern can be really, really helpful.
Mm. So if we were to look at the definition of hyperventilation, because again, that's a word that everybody knows, but
Yeah,
actually, how would you describe that? I mean, there's a clinical definition of hyperventilation, presumably.
yeah. So my understanding is that it's breathing more than there is a metabolic demand for.
Aha.
So and it's so interesting because there's so much interest in breathing, particularly I think over the last 10 years. And there's different schools of thought around this. But there are, I don't know if you're aware of things like the Buteyko method, and there's various kind of derivatives of that, which, from my understanding and interpretation of that, um, there's something about modern life which is causing most of us to
Mm.
overbreathe. The fact that we're quite sedentary and our stresses are happening when we're still. So we might be sitting at a computer having a conversation, or immersed in very intensive work while sitting at a computer, or doing other kind of sedentary work, but the stresses are not being dissipated by physical activity, uh,
Yeah.
because we're in that still position. So yeah, there are interesting schools of thought around this being actually something that's an issue for most of the population, and that our um, the kind of with so according to accepted, if you look at how much our breathing rates, according to the healthy normal breathing rate for the population would be supposed to be between about 10 and 14 breaths per minute. But some of these interesting schools of thought are suggesting it should actually be lower than that for everybody.
Okay.
So that's kind of another thing which I'm curious about, and I'm interested in
Yeah.
learning a bit more about that. But specifically for our kind of population, there definitely seems to be something going on with some people
Yeah.
where looking at breathing can be quite helpful.
Yeah. And what is some, I mean, we've touched on hyperventilation, but what are some of the most common sort of patterns that you might see with the clients that we see?
I think it's very common to observe significant chest breathing from the chest. So it's a bit like what I was saying before about I had no idea about how to use my diaphragm in breathing, and the most effective parts of the lungs for gas exchange are the bases of the lungs.
Mm,
So we want to get and it also enables you to breathe much more slowly if you're breathing from your diaphragm.
mm,
So yeah, so chest breathing is very common, and it's obviously quite easier to observe that
mm,
if you're talking with somebody over video. There is to some extent um, when you're having a conversation that is a bit of an excess demand, and so a little bit of chest breathing might be okay, but in general, if you're seeing a lot of that,
mm,
um, I think that's a potential sign for something that could be improved on, and the breathing pattern could be improved.
mm. So again, sort of some people will be complaining of being short of breath, and as you said earlier, maybe not actually even doing anything. Yeah, what they say doing being the physical side of things, perhaps, but even just sitting and being short of
Absolutely,
breath. Yeah.
absolutely, because it can be triggers around. It could be the temperature in the room. It could be caffeine. It could be feeling under pressure in the conversation,
Mm,
and it may be that with our group of clients that we're seeing, if you apply something like the dysregulation model, it makes sense that this client group would be potentially some maybe more sensitized to those kind of triggers.
mm.
Um, does that make sense? To that?
Yeah. Yeah, exactly. I had a client yesterday who, again, during our conversation, was complaining of being short of breath, and
Yeah,
I said, "Oh, has it been a bit of a rush to get here?" And she said, "No, I'm
no,
here." So,
yeah.
yes, it is. It doesn't always make sense. And I've had another client as well who said to me, we talked a little bit about diaphragmatic breathing, probably not in the detail that you do. And she said to me, she said, "Yes, I've just realised I do upside down breathing," and I thought that was a lovely way of.
Oh yes, yes. Upside down breathing. Yeah, it's very, very common. And I think so I think part of this may be to do with almost like the modern human condition. And then there's also the increased propensity of this associated with our client groups, particularly people with ME/CFS and maybe other conditions as well, where this dysregulation model might apply in those circumstances. That's my interpretation of it when I've been trying to make sense of that.
Yes, exactly. And some of this is all just about making sense and making sense and making sense for us. So
Yes,
as
yes.
individuals, it is. So maybe the conversation today will make sense and hopefully
Yeah.
make sense to other people. So I was curious, I mean, what exercises, we have to talk about exercise because you're a physiotherapist, but what
Yes.
exercises do you find effective for improving breathing patterns? So, what sort of.
Yeah, I mean, I love to. Maybe what we could do is I could guide you through a breathing control exercise. So, yeah, and I think so. Just before we start, I guess think the kind of the three things that we're aiming for. So this would be we're aiming for to retrain a more kind of normal breathing pattern, and that would be through the nose, low, so from the tummy,
Mm,
and slow. So nose, low, slow.
Brilliant.
So,
Good way of remembering that.
yeah,
Like that.
yeah. And there's another nice phrase: "If in doubt, breathe out." So having the emphasis more on the breath out.
Yeah.
So kind of lengthening that breath out
Yeah.
can be a really great way of slowing things down and not having so much emphasis on the breath in that can bring in more chest breathing
Yeah.
and faster breathing as well. So that lengthening the breath out.
Yeah. Yeah.
So yeah.
Just as an aside, I mean, I've spoken to a number of clients over the years, and looking at, and we'll talk about the exercise in a minute, but certainly, I think tying in with what you just said around why sometimes we feel short of breath, it's not always because we've been busy and active. It's sometimes more of the dysregulation or anxiety and stress, and it could be any of those, but looking at some of the techniques and talking about exhaling, and some of them talk about counting. I've come, I get in a little bit of a sort of disconnect slightly in that, there are a number of examples out there of breathing in for a certain number and breathing out for more, obviously. But that can sometimes perpetuate those feelings of anxiety if you can't count, can't breathe out for eight that you're expected to. What would be your
Yeah,
advice? So
yeah,
actually, I can only breathe in for two and out for three. Is that okay? When a lot of people are there, and you should breathe in for this and out
yeah,
for longer.
absolutely. I completely agree with you about that. That sometimes trying to aim for specific numbers
Yeah.
can kind of perpetuate anxiety if people are trying to get it right.
Yes.
Sometimes it can be really helpful to have numbers. So I think
Mm.
having it as an option can be quite useful.
Yeah.
I guess there's two quite popular ones which I often people refer people to, which might be box breathing and the 4-7-8 technique.
Mhm.
These are also, very good for relaxation as well, because of course when you slow down the breathing, it's a great,
Yeah.
even for people who don't necessarily have obvious signs of breathing pattern disorder,
Yeah.
those kind of breathing techniques are going to be good for relaxation. But
Yeah.
some people don't get on well with counting at all.
Yeah.
And but there's also the option for working out numbers, kind of just experimenting, playing around with it a bit and working out what is the number that works well for you. Because also your pace of counting might be different. And I quite like, because we're trying to slow things down,
Mm.
if you're counting in your head, having a nice, slow, calm voice in your head as well, not a 1, 2, 3, 4 in, out, 2, 3. It's not relaxing, is it? So,
No.
you know, and so it's playing around with it. Sometimes using a word can be quite good. I remember actually when I was working as on the respiratory wards, we would use uh, elephant, so breathing in
Interesting. It's yeah.
elephant, or it could be something funny, just funny, light-hearted, or a word that kind of is meaningful to you. You can kind of
Yeah.
play around with these kind of things a little bit and see what
Yeah.
works best for the person. And
Yeah.
having different options, I think,
Yeah.
is
I've
really.
sometimes talked to someone about, using breathing in for re and out for lax, and trying to
Ooh,
like,
lovely. I like that. Yeah,
lax. And
yeah,
but again, and I think what you've just said is incredibly valuable. It's going to be individual, isn't it? We're all slightly different. We'll all function in a different way. So finding what works for you is absolutely the bottom line.
absolutely, absolutely. And I think, yeah, it's just trying different kind of options, as
Yes.
long as it's including those concepts of nose, low, and slow.
Brilliant.
Obviously, for
Brilliant.
some, yeah, some people they can't breathe through their nose initially,
Yeah.
and so if anyone's listening to this and finds it really difficult to breathe through your nose, don't force it. Just do what you can with it. Maybe partially breathe through your nose. See if you can start practicing little bits of breathing through your nose, but this breathing control exercise that I'm going to go through with Charlie will be impossible if you're forcing yourself to breathe through your nose, and yeah, and you just get out of breath. So for those people who find it difficult to breathe through your nose, just take it gently with it, and do what you can. And if you can't breathe through your nose at all, put your focus on the other elements. So breathing from your tummy and breathing slowly.
Lovely.
Um,
Brilliant.
so yeah, shall we give it a go?
Shall we? Shall we?
Yes.
Let's have a go.
Do you have any issues that you're aware of with your breathing? I mean, I haven't noticed anything obvious since we've been talking, but do you have any difficulties breathing
Good.
through your nose or?
No, we're okay at the moment. Yes, no colds, minimal hay fever. We should be fine.
That is definitely a factor as well. And that can be really, really tough because, of course, it would be difficult to breathe through your nose if you've got hay fever, which a lot of people do at the moment. So, um,
Absolutely. Yeah.
yeah.
Don't.
So, what I usually suggest is just get comfortable first of all. So, make sure that your feet are on the ground. You look fairly relaxed and upright. I don't know if you've got a surface behind you that you can rest into. You don't have to, but you can either just sit comfortably upright or rest back into the chair, but reasonably upright. So you've got the option for your tummy to move. So just start bringing your attention to your breath, just observing your breath to start with. Notice where you're feeling your breath, where the movement is. Just notice the length of your breath in compared to your breath out. Check if you're able to breathe through your nose, breathing through your nose where possible. If you want to, you can put your hand on your tummy or just have an awareness of where your tummy is. As you're breathing in, feel the expansion of your tummy. As you're breathing out, just allow your tummy to relax and let go. So just noticing the rise and fall of your tummy. And if it feels comfortable to do so, just breathe out for a little fraction longer. Keeping aware of the movement of your tummy, breathing out comfortably for a fraction longer. If it feels comfortable, just extend the breath out a little bit longer. Just notice that moment at the end of your breath out before you breathe in. Just pay attention to that moment. And when you feel ready, just come back to breathing normally and open your eyes when you're ready.
That was fascinating.
Hmm.
It's really it's really interesting to take the time to focus on your breath, isn't it? It's just something that we don't do very much. And it felt like sort of expansion, that sort of it feels like you're just stretching yourself a little bit, like you would do an exercise, perhaps.
Yes, yes, very
Yeah.
good. Yeah, very good. It's amazing, isn't it, how our breath is always with us, isn't it? Of course, it's always with
Mm.
us, and it's always available to us to adjust and change. And I'm interested if, like, I mean, obviously we're in a slightly more unusual. We're being recorded. It's a podcast, but how did you find the experience of doing that?
Yeah. No, it was good. It's as I say, it's something that we don't take time to do and to focus
Yeah,
on. Um, I think there's a tendency sometimes to overthink these things. So noticing again the busy mind and how actually even just focusing on our breath is quite a nice time to pause and
yes,
stop. And
yes,
even though it was just a few minutes, it's that lovely opportunity that you can do
yeah,
anytime. Punctuating your day with those pauses is a great skill to be able to sort of um, recharge, reset, focus on the breath. I would say expansion. The expansion
yeah.
is the word that comes into mind.
Yeah, and it's like, yeah, it's yeah, what's possible just right there within you. It's right there. And
Absolutely.
as you practice with it as well, I don't know whether you do this already, but it's something that you can use as well as during pauses, but in your daily life, as you're going along, when you're listening to somebody during a conversation, if
Yeah,
you notice that you're feeling a bit tense about something, just slowing down the breath and breathing from the tummy can change your experience of that conversation.
absolutely. It doesn't require any specialist equipment. It doesn't require any, you know, necessarily designated appointment time or whatever. You can anywhere, anytime. I love that. And I love what you said about nose low and slow. I think, if nothing else from today, that's something that I'm going to take away, and hopefully
Yeah.
those that watch or listen to this will take something away. So, I mean, with that in mind, have you got any other take-home messages? And then we will think about wrapping this up. So anything else that you want to mention?
I think just to say that, kind of reiterating that point, your breath is always with you. It's always available to you. And whether it's through simply observing your breath, noticing what's going on, or just playing around with it to actively change it. There's so many different things that you can. This is just a little snippet, but there's so many different wonderful things you can do with your breath to have a play and see what happens.
Fantastic. So not to be fearful. Have
Yeah.
a go, experiment.
Yes.
Emily, that was just phenomenal. That was really, really helpful, really wonderful to have an experience like that. And hopefully, as I say, people will take little nuggets of information away from today. And obviously, if you want any more info, get in touch with us. Emily is the person that is experienced and has all these wonderful insights within the realms of breathing and all things breathing. But really, really thank you for sharing those today. It's been great.
Thank you for having me.
That's okay.